Today we're asking a question that cuts to the heart of medical affairs. Is your team truly separate from commercial, or are we just pretending? Now, it's tempting to say yes. After all, your org chart shows that there are two neat boxes, medical over here, commercial over there. But regulators don't care about PowerPoint slides. They care about conduct, they care about process, and most importantly, they care about intent. The truth is, if medical is being used to advance commercial ends, you may already be walking into compliance quicksand. Let's start with the elephant in the room, the 2013 GSK settlement. GSK paid $3 billion with a B dollars to resolve allegations of unlawful promotion. They also were looking at issues of failure to report safety data and false price reporting. One reason the DOJ came down so hard was the blurred line between medical and commercial. The government alleged that scientific exchange was being pulled into the orbit of sales. So they were looking at advisory boards, medical information, and even responses to unsolicited requests, and they said that they all looked suspiciously promotional. The settlement was a wake-up call. Medical affairs doesn't just get a free pass. If regulators see medical as simply commercial in a white coat, the penalties are staggering. Now, I know some of you are already thinking, but wait, what about Coronia? What about Amarin? Didn't those cases say that companies can share truthful, non-misleading information with doctors? Yes. Those cases carved out First Amendment protections for certain off-label communications. But here's the problem. Those rulings don't shift the central compliance risk when it comes to medical-commercial separation. Because the real issue isn't just what you say, it's why you're saying it. And that goes straight to intended use. The FDA has made it clear that intended use starts well before promotional copy. It's reflected in how you train your teams, what materials you develop, and which patients or physicians you target. If medical affairs is shaping messaging or engagement based on commercial objectives, you're no longer in a safe harbor, even if the words themselves are truthful and non-misleading. And that's why Coronia or Amarin will not protect you if the DOJ or FDA sees medical as part of a broader promotional strategy. Those cases can help at the margins, but they don't erase the fundamental expectation that medical affairs must be independent. Now, non-compliance doesn't just mean headlines and fines. It means loss of trust with HCPs, internal confusion, and increasingly personal liability. Think about the False Claims Act, the anti-kickback statute, and securities law disclosures that can all be implicated. We've seen cases where medical affairs leaders themselves have faced scrutiny, not just in the company. That's because under DOJ policy, individuals who should have known about misconduct are fair game. Think about things like the Park Doctrine. So when medical and commercial overlap, the risk is not only corporate, it's personal. And this is why I want to talk to you about solutions. Obviously, you want legal advice. For many companies, the problem isn't just bad intent, it's messy execution. Medical and commercial share information, but how do you prove that the walls are intact? How do you show regulators that medical activity is independent, defensible, and documented? Consider the right tools. CERIS can help. CERIS provides a controlled environment for sharing documents and tracking access. It enforces firewalls by design, ensuring that scientific exchange stays in medical's hands, while audit trails prove that. When regulators ask, show us how you separated medical from commercial, you don't want to waver on policies, you want to show systems. CERIS makes that possible. Reach out to me if you want to know more about CERIS. Another gray area is patient engagement. Everyone agrees that patients should be more involved, better educated, more engaged, more supported, and medical affairs is often the natural home for this work. But this engagement can slip into promotion if not handled carefully. If patient programs are influenced by commercial priorities, targeting certain demographics, focusing only on high-value prescriber patients, is seen as inducements. We've already seen cases where patient support initiatives turned into a disguised marketing campaign. And when that happens, regulators don't buy the idea that it's medical affairs acting independently. They can see right through it. They see it as a promotional tactic, plain and simple. The challenge is making sure that your engagement is truly educational, it's evidence-based, and it's insulated from sales goals. Look at the fraud alert from earlier this decade, from I think it was 2021 or 22, where the DOJ and OIG actually called out speaker programs. Done right, patient engagement is a compliance asset. Done wrong, it's a liability. So let's pause, let's reflect, let's ask your team, do we have documented processes, not just policies, that prove our independence from commercial? Could we defend our workflows if regulators questioned our intent? Are our patient engagement programs designed with science in mind, or is it sales? Do we have systems like CERIS to create evidence of independence, or do we just depend and rely on trust alone? If you can't answer yes with confidence, you are vulnerable. Medical affairs is often seen as the conscience of the company, the voice of science and of evidence. But if that voice is shaped, even subtly, by commercial intent, regulators will see right through it. The GSK settlement taught us that the price of blurring lines is steep. Citing free speech cases like Coronia or Amarin does not change the focus, because the fight isn't just about speech, it's about intended use. And intended use starts long before you put words on paper. The bottom line, don't just pretend that medical is independent, build the systems, show the government, and make sure the culture is real. Because in this environment, pretending is not just risky, it's ruinous. Follow our page on LinkedIn. And if your team is struggling with medical commercial separation, the Kulkarni Law Firm can help you turn that paper wall into a real wall. Call, click, or email